was in a car accident and I was rear-ended, and at the time I remember that I had to call in sick from work, and my body was so nervous and I felt so awful, and I just slept for a couple of days just laying in bed, and I didn't know that I had even a neck problem.
11 years ago, I was in a motorcycle accident with my girlfriend out in Sturgis, South Dakota. Another motorcyclist came up from behind us and hit us from behind, doing around 60, 70 miles an hour. That's where the journey began. Is like we went to medical doctors and neurologists and regular chiropractors.
Right before I started seeing Dr. Phillips, I got rear-ended by a drunk driver. I was stopped at a red light, and a person hit me at 50-ish miles an hour, and I got in soon enough so that I didn't really start to experience too much of the damage. I mean, a lot of people, you get hit when you're at a dead stop at 50 and somebody hits you at 50 miles an hour and sends your car flying around and bends it up. People end up with headaches and all sorts of issues.
If you put a distress into the structure of the human body will not be normal. And people come in for back pain, they come in for headaches, for migraines. Some people come in for allergies now. Some come in for acid reflux disease, some for sciatica or radiculopathy or pain down an arm or shoulder. But most of these things relate to this one simple idea, and that is the structure of the body misaligns and creates a disturbance in the nervous system and affects the way that people are able to live, work, and play.
I was in pain for a very long time, perhaps about 5 years. One of the chiropractors told me that in 5 years I could have been dead because all my organs were going to go into failure.
About 7 years ago, I was diagnosed with a brain tumor, a non-cancerous brain tumor. And I had put out a prayer request to a bunch of friends, and one of my friends who lives out in North Carolina actually responded to me. And she said, I'm not sure if this has anything to do with your condition, and it's, you have to deal with things where it's at right now, but I just thought I'd tell you about Upper Cervical Chiropractic Care.
Migraine headaches were probably the worst. General fatigue, just because you play out quicker. And I was most comfortable in this position, but you get a lot of funny looks walking around like that, and also you can't see where you're going. So it's really no way to go through life.
When I began this journey, I began to realize that my body had had multiple injuries throughout the years, and actually as we kind of went back in time, realized that my complications started when I was 2.
I would have issues trying to sleep sometimes, or I would just get severe pain between my shoulder blades, and then in the neck it would just for weeks on end. Sometimes I'd feel like I'd slept funny, but it just never went away.
I've had neck problems for many, many, many years. And I started Upper Cervical, and it saved my life. From going to surgeries, I went to different doctors, neurologists. They said there's no hope. I'm going to be, I couldn't walk anymore. My spine was degenerating so bad. I had back problems. It started out with a neck injury, then it went through my whole spine.
The other thing about this idea is that it is progressive and degenerative. The longer it is there, the worse it gets. So most people have degeneration in the body, whether it's in the spine or in the hip or in the knee. Most people believe that this degeneration is a sentence, like a life sentence, that is never going to go away. Most of the problems that I take care of, the misalignment has been there for 7 to 10 years before the event shows up that creates the crisis that caused me to see the person for the very first time.
When Dr. Doug, as I call him, out in Colorado, worked on my shoulder, I had no idea what had happened, and he said, well, you must have played football. And all of a sudden it flashed back to my senior year in high school, and I think the second to the last game that we played, and I'm coming back on the bus with my arm in my shoulder pads because it got stung, and I guess that, at least that time I'd found out exactly what had happened about 50 years before. which I have a few other injuries, like my wrist, which he's worked on too, that I know I got from shot putting in college, but that was until he gave my shoulder a pop and said, you must have played football. It never really occurred to me what had happened.
I come from a stubborn family, so what our tendency to do is live with it, and whatever is bothering you, it'll heal in time, or if it doesn't, then, that's just your new normal.
I've had fibromyalgia for 35 years, and that's not really an injury, but it creates muscle and connective tissue pain on a daily basis. Most of the things that I tried when I went to doctors, and I've been to a lot of them, they were temporary. They didn't really last. Sometimes it was only hours worth of relief and then back to the normal pain. And I was on pills for a lot of years, and that made the symptoms worse. There were a lot of side effects. So about 8 years ago, I got off of all the pills, and I've just been putting up with it.
People are taking analgesics and pain relievers. They're taking anti-inflammatories. They're taking pain pills and muscle relaxers for the structural parts of this problem. And that's only part of it, because when you hurt long enough and you learn to deal with the pain and repress the pain, you're going to take antidepressants too, because when you hurt long enough, you're going to be angry about it.
Actually, I've had an injury probably since I was 25 years old, basically, and I just lived with it for many, many years, and then I started going to a regular chiropractor, which helped me a lot. But then after years of doing those adjustments, it hurt too much, so the chiropractor sent me to a neurologist, and from them they put me on medications, gabapentin, and I went to the pain clinic. I've been MRIs, and I went through the system, and so then somebody mentioned the upper cervical, so I did that, and I haven't done all those other things since then.
My sweet ladies at the prayer group, I would pray with them every week that the Lord will heal me, because I was in pain. I couldn't sleep, I couldn't sit down, I couldn't stand up. I mean, I don't even know what was going on with me. And I took a beautiful journey to Israel seeking for healing as well. And in that trip was a gentleman who his brother is a chiropractor. So after the trip, is still in pain, I decided to ask him if he can give me the phone number of his brother so that I can have a chat with him. So I got a hold of Dr. David Phillips. His brother is Eddie, and he referred me to him. So I had a chat with Dr. Phillips.
And one of my friends, she had been going, and she had, in a matter of 90 days, and she had just started going 90 days before that, and in 90 days she had saw her diabetes start turning around. She was starting to lose weight. She was quite a bit overweight, and she was talking about that with me, and she said, I'm not sure if this has anything to do with you. So I dealt with the situation at hand with the tumor, had it removed, that sort of thing, and I looked into Upper Cervical in the Twin Cities area, and the only one I could find was way over on the other side of town. So I just kind of put a prayer out to God and said, if you want me, if this is something important for me, then you'd bring them to me. And lo and behold, a year later, I'm at a wedding and Dr. Dave's there.
On the first encounter with people, a lot of people are a little bit nervous and scared about coming in, because first they don't know if we can help them, and they don't know if this is going to work.
I had a friend who came to Dr. Phillips first, and then she gave me that book, What Time Tuesday, and I was reading it, and I kind of was intrigued by the changes that happen there and all that. And so as I'm looking at it, I see the back or all the different things that upper cervical can do for you. And I showed it to Larry, and I said to him, I would really like to be interested in checking this out.
Once I realized that Kathy was experiencing some sort of relief from some issues that she was having, and I decided I was going to come over to Dr. Phillips' office and see what exactly he was doing over here. I'm educated as a physiologist. I'd been in medicine for a number of years, and I never was a believer in chiropractic. Still am not, actually, in the way it's traditionally practiced.
I set up an appointment and came over to see Dr. Phillips, and then my atlas was out, so he did an adjustment. And then I think Larry came over with me when I was getting the adjustment done, because he was really leery of this whole thing, and he wanted to see what this was all about in that. So he came, and Dr. Phillips explained to him the process of upper cervical.
I like for patients to check me out before they actually become patients in the practice. I really like a person who asks a lot of questions, who wants to see someone else having their spine corrected, that wants to know how this works, and who asks how long is this going to last, and what are you going to do after that, and what's in it for me, and how is this going to work for me. They ask all these questions, so I happen to be a skeptic myself, and that's really what causes me to appreciate taking care of skeptics.
I was a little bit skeptical. I also worked for a chiropractor, so I've been in the chiropractic field for a long time and had not really heard that much about upper cervical. And so it was interesting to try another aspect of chiropractic, and I was very, very pleased.
My wife had it done, and I was skeptical, but the first time I had kind of come to see an adjustment that she had done, and just from her testimonial and her improvements that she had physically, it was really kind of put my mind at ease in terms of being skeptical of any adjustments.
The first time I heard about upper cervical chiropractic, I didn't know what that was, and I didn't think it was connected to the problems that I had. Some of the problems I had is low blood sugar. I said, well, that's not what's wrong with me. I'm sick. I didn't know why. I don't have energy. I don't feel good. There was immediate improvement after I finally did go in and get the adjustment. And many different things that I are difficult to describe, like hypersensitivity to light and sound, always keeping the lights down low, not liking to drive at night because the bright lights of cars really, really bother me. After I got adjusted the first time, and there was significant improvement in my upper cervical atlas, immediately I remember I went to work, and noises that would have really annoyed me and bothered me didn't bother me at all.
The adjustment is totally different than a regular chiropractor that a lot of people are familiar with, in that he takes 3 very specific views of your neck, and then he mathematically figures out what the best angle would be to get that to be a level orthogonal position for the atlas. The other chiropractors also adjust the atlas, but if there's an imbalance, and so it's like if it's torqued at all, then if they adjust it, it's going to put pressure on the brainstem in that area. Whereas with the atlas orthogonal or the upper cervical work, they determine how to best get it as close to a level position as they can, and that's what made the huge difference in my life. And so the adjustment is with a very painless instrument that he puts in a very precise location for the atlas, and it's no more than 5 pounds. It doesn't hurt at all. There are different methods of adjusting also. Sometimes he will use that tool, other times he will use his hand. The thing that I really appreciate about Dr. Phillips is that he's not only one way. He has a lot of tools in his tool bag, and he suits the tool for what the need of the patient is.
When I got here and he's telling me that he's working on a whole different aspect of chiropractic, actually the way it was originally designed on the upper cervical portion, working with the brainstem and the surrounding bony structure, he spent about 2.5 hours working with me on the anatomy and physiology and what was going on and how he was, having an effect on it. And I couldn't deny anything that he was saying. And so I said, well, let's suppose that you did have something. What is it that you do? And he gave me a gentle explanation about it. It's pretty simple. And I said, well, how would you know if you had any of this? He said, well, I would do a history and check, and then I've got 5 things that I can examine, and they'll tell me, you know, if that's a situation. I said, well, why don't we do me? And he said, okay. So we chatted some more. And after going through a number of things that I was experiencing, and you know, I was in my mid-60s and figuring I'm getting older, and I said, you know, some of these things are happening. And after we were finished, he says, okay, anything more? I said, no, not that I can think of. He says, good. All right, well, you've given me 12 things that have absolutely nothing to do with the fact you're getting older. And I said, really? He goes, no. I mean, he says, this is not what should be happening just because you're getting older. I said, okay, what do you think? And he says, I can tell if I do my 5 things. I said, well, how long will that take? He said, come on over. So we did. And he said, yes, you have all 5 issues, and you have the situation. And I'm like, okay, so what do you do about that? So he introduced me to the equipment and the various techniques that he can use for putting this stuff back into place. And I said, okay, how do you know what to do and how much of it and where and everything else? He says, well, I'll do x-rays and we'll go through all of that. And I said, okay, I'll pay for that. So we did. And it came back and we went through the x-rays, and I'm not great on x-rays, but I could see what was going on that one. And I said, all right, let's go do what we're supposed to do. So he did, put me on the table and positioned his instrument and hit the plunger. And I said, that didn't do anything. He goes, oh yes, it did. I said, no, it didn't. He said, yes, it did. At which point, all of a sudden, I got this warm rush down my neck. And I'm like, what is that? He said, my guess is that you were probably impinging on a blood vessel and you have not had full blood flow there for quite a while, and now you're getting it and your body is warming up over there. I said, you're kidding. He said, I don't kid.
If I told you that we could touch you behind the neck, behind the ear, with a nifty bit of engineering and correct the structure back to normal and take the pressure off the brain and the brainstem and spinal cord and restore your ability to live, to work, to play, what an idea. It's just simply ahead of its time.
I just want to add a little bit about my friend Lori that I worked with, and she came up to me and she said to me, do I look any different? And I'm like looking at her and I'm thinking, well, I could see that she was more at ease and seemed more calm and like she wasn't so stressed and everything like that. And I believe what it was that her atlas being adjusted.
When I had my first adjustment, it was amazing because the old phone cords that would get all wound up, that's what I felt like. I felt like someone had unplugged the cord and it was just spinning and I was loosening up and literally unwinding.
When Dr. Phillips put it back in, it was within just a couple of days and I was at work. Wait just a minute. And when I stood up, I felt my spine just like a release. And it was kind of like I felt, this word that came into my head was finally. That everything was just lining up below it, and that my body was finally saying, finally, you've taken care of this big, and it was a big issue, and I could tell by that sense. So I guess what I'd say about an atlas and what I describe it as is a base for everything else that falls behind it, the vertebrae, the disc, and everything. So I felt great relief in that moment, and I knew. I was getting numbness down, I don't know, I think it was my right arm. This is a few years back now, and you know, I had to come in and see him probably a few times a week, and to get my neck to hold back in place. And it kept me from having any long-term injuries. I mean, a lot of people, you get hit when you're at a dead stop at 50, and somebody hits you at 50 miles an hour and sends your car flying around and bends it up. You know, people end up with headaches and all sorts of issues. And because I was in to see him soon enough, I was able to stay relatively, you know, I was able to stay healthy, and I didn't experience any severe pain because of it.
You know what I see in practice every day. It's almost impossible not to get excited with the work that we do. I see people come in and who've been suffering sometimes for weeks or months or years. Some people starting hurting yesterday, but you know, what we do works so well that many people get relief after the very first correction that we make on the structure of the body.
My vision started to improve. Kathy even said at one point, she says, I think your hair and your bald spot is coming back a little bit. Okay. Digestive issues, sleep issues, sexual issues, sensation in extremities, and that was better. It was just like, what is this? And that went on over about 6 to 8 months, where there was just this constant improvement of these things that were, because I was getting older. And he had originally thought there would be about a 12 to 14 step process with me. Well, I got to about 9, and he says, I'm not going to go any further with this. He says, you're responding, I can't believe how well you're responding for a person at your age. What are you doing? I said, I'm just doing what you tell me. He goes, what a novel approach.
Spinal care is about keeping the structure of the body corrected. It's about keeping the nervous system clear. It's about living with all those effects that slow us down, limit our lives. It's about opening up life and letting it be whatever it was designed to be.
Until I came here, I never heard of upper cervical until I came to Dr. Phillips' office, because I was here mainly because he was a Palmer grad, of course.
I was trained in the traditional chiropractic methods at Palmer College, and most of the chiropractic education today teaches traditional chiropractic adjusting or manipulation. And that has benefit to a great number of people. But there's this little known, very effective procedure, and it's based on measurement. And it uses principles of mathematics and physics and biomechanics to actually identify and correct the spinal misalignment. And using that procedure, we can actually take x-rays from 3 different perspectives and draw lines and take measurements of exactly how the spine misaligns and how it needs to be corrected.
Well, one thing that really impresses me about Dr. Phillips is his total, complete honesty. And initially I wasn't sure whether I could believe him or not. I mean, that's sort of the way it is, I suppose, when you meet anybody. But the more I got to know him, the more I realized, yeah, he's totally out there. He's totally saying exactly what he means, and he doesn't hide anything. So it's very good.
He knows my family. He'll ask about my work. He knows personal situations. It's not something that he's only just I guess treating you physically. It seems like he takes a personal interest and cares about you as a person and what interests you and what may help you.
I feel like he's really a friend, and I know that I met him at a wedding, so we kind of started out as getting to know each other and being friends and stuff. But I also have many friends that I've sent to Dr. Dave, and they all feel the same way about him too. He's that he cares.
I think it's about 3 years that I have seen Dr. Phillips, and I've always been impressed by his office staff and him. He's very kind and compassionate, and one thing that I really, really appreciate is that he's such a good listener and really takes his time with people. You never, ever feel rushed, and it's been good.
Dr. Phillips has his own story and his own journey, his own experience, so it's empathy, but it goes beyond that because he's coming from where you are, and he's been in places where you have been.
He's got jokes, and he tries here and there, and he does a pretty good job of remembering certain things about you, so that it's, instead of just this stale, the doctor will see you now, and then he comes in and does this thing and then wanders off, like is so often the case with what we're used to. He has a conversation with you, and I don't know, it's like going to see a friend almost.
With Dr. Phillips, there is an end time to this. It's not like an ongoing, like a normal chiropractor would be, where he has you come back every week, and just wants basically your money. Where Dr. Phillips has a set up time, and he kind of like explains to you how long he thinks it's going to be, and then sometimes it's less or more, because like with me, my atlas kept going out for a while and Larry kept holding his, but once mine seemed to stay in, and now I would have been like 6 months since I've been here last or something, mine's still holding, so I'm good. And he said come back whenever I feel like I want to or something like that. And so that's one thing that I appreciate about him, is that he's not in this for the money. I mean, he obviously has to make a living, but yet he's doing it because he really cares about his patients and that. And his demeanor is very professional. He's very courteous, very kind.
When I came in here, one of the fears, the valid fears that I had was I was unemployed at the time, so my funds were limited. I was collecting unemployment, but I was concerned. And he took that fear away from me. And he is willing to work with people because he knows, and he's been there himself. And there is a way to work things out. And he is one that's willing to do that and work that with you, because again, the fear and the stress of finance, the pressure, that affects your health. And again, that coincides with you being able to relax so that he can give you the care that you need, and the finances will work themselves out.
What we found over the years is that people don't really care how much we know until they know how much we care. And so when we make payment options, we ask the patient, is this something that you're able to do? And we ask them, how are you able to do this? And then all we do is sit back and allow you to make the arrangement. And when you become unable to make the arrangement, we just ask you, we don't make you wrong for that, we just ask you, well, how are you able to remake the agreement?
I would encourage anyone to do upper cervical before they try other things. It's actually cheaper, because after you start getting medications and payments for all the different things you do, your cost is a lot less. At first you go in a little more, but then you go in as needed, and it's less often. But you feel a lot better, and it's a whole new world opening up.
I've probably referred several hundred people over the course of several years, and I got to the point where I could recognize folks who had the issue. And we'd be walking around, or I sat next to a plane, a fellow on a plane one time he's going to New Jersey, we're coming out of Puerto Vallarta. And I saw his cushion that he had with him. I said, what's that for? He says, oh, this neck thing is so bad. And I said, really? And I said, how long has that been? He said, oh, it's a couple of years. I said, where do you live? He says, in New Jersey. I'm going to give you my email address. I want you to get home and send me your information. I've got a guy in Minnesota, and I'm sure he has some associates out in New Jersey. You really want to talk to these guys. And we spent the flight explaining to him what I had experienced. And he goes, I've been to chiropractors. I said, not this kind. This is completely different. This is the way chiropractic was intended.
We are going in there and actually moving structures that will affect the structure clear to the end of the spine. And it's a closed kinetic chain effect. An open kinetic chain is like a row of dominoes where you hit one and it affects the other, and so on. Closed kinetic chain is like those executive toys when you pull the balls on the end of the string and affects the one on the other end. What we are looking at here is going through on the top and unraveling until we set the whole thing in a more vertical position. The beauty of this work is that we don't have to constantly go in there and work on the structure of the body. All we have to do is get the structure in line and teach a person how to tell whether it's in or out of line.
But it's one of those things that is utterly unique and very effective, and I anticipate success for anybody who comes in here at some level.
I found Dr. Phillips very accommodating and friendly, and I liked coming here. What was surprising was that the pain in my neck that I've had for 30 years was gone after the first session, and I haven't had it since. That was like a couple months ago. and I haven't felt any pain up there since. So that was one thing I've had for a lot of years, and it just went away.
Boy, he is so professional, and everyone treats you with tremendous respect, and I feel very comfortable here. And I feel like he's really understands things so thoroughly, and it's good to know. It's very comfortable to trust him with your care.
I can live my life now. Praise God, amen.
It's just improved my overall, feeling. Pain has been reduced and eliminated, and I'm just more freely able to, go about each day and enjoy each day and activities. And I would definitely recommend it to anybody that feels restricted in their movements and their activities. It's definitely been a positive for me.
He's more than accommodating and helpful. He doesn't want to refuse anyone treatment for lack of ability to pay, and I'm thrilled with his rates. I've been to many chiropractors through these years, and he's more than fair.